Hello, my name is Dr. Kemi Akanle, and I'm here to speak to you today about adult ADHD. Adult ADHD, which stands for Attention Deficit Hyperactivity Disorder, is a clinical syndrome which begins in childhood and persists throughout adolescence and into adulthood, causing significant impairment throughout education, home life, and work as an adult. The three core symptoms involved in adult ADHD are inattentiveness, hyperactivity, and impulsivity. With ADHD, you can either have the inattentive type, the hyperactive type, or the combined type. The treatment is the same for all three. It just depends on how the patient presents in terms of his or her symptoms. The symptoms of inattentiveness include poor focusing, poor concentration, disorganization, making careless mistakes, having racing thoughts, which can sometimes keep an individual up at night, and also what's called zoning out or not listening, because there's a lot of daydreaming involved. Symptoms of hyperactivity include a constant feeling of restlessness, difficulty sitting still, fidgeting, having to stand up from your seat several times, impatience, and also increased physical activity, which actually makes the individual feel better. With regards to symptoms of impulsivity, these include making decisions on a whim, not having much forward planning, spending money impulsively, starting relationships and ending them quickly, and also getting into risky situations such as gambling and financial difficulties. With regards to treatment, there is treatment available for ADHD, which is usually in the form of stimulant medication, but also for those who cannot tolerate stimulant medication, they can also benefit from non-stimulant medication. The medication works by controlling the symptoms because there is no cure. But when you do take the medication, your symptoms will be controlled over a number of hours, which should give you the opportunity to make you more productive either at school or at work, less restless, less impulsive, and therefore have a better quality of life. When you do stop taking the medication, your symptoms unfortunately will return. Another way of treating symptoms is through psychological intervention such as cognitive behavioral therapy, which working with a therapist can target the symptoms associated with ADHD, which include disorganization, poor planning, and come up with sort of practical tips in which you can improve your concentration and be less forgetful. Tips for carers or parents living with people who have ADHD is that the patient is equally distressed by their symptoms. They want to do better at school, they want to be more productive at work, and despite numerous efforts seem to fail by either making careless mistakes or being quite forgetful. So if you can avoid negative comments or blame, that would be helpful because they are aware that they're struggling and they're doing all they can to try and improve their symptoms. Also help them to seek help in time, because the sooner you seek help, the quicker they can be treated and their symptoms can be controlled. And also it's about getting you to understand that this isn't something that they're bringing on purpose. They're not trying to be difficult on purpose. It's just part of the condition. And if you do seek the right help, there is help available, and there's usually a significant improvement in one's symptoms once they get the right medication on board.